Hi there, and welcome to Canceling COVID. I'm Tanya Rivens. We meet every Tuesday at this time to talk about what's happening in our community. We're talking real talk, real people, real resources, a conversation that we have, and just trying to enlighten you and empower you and make you aware of what's happening in our community. This is an ongoing thing, folks. We've been doing this now for almost 2 years. Who would have thought? And we're so grateful for all of the support as you continue to support us and share and make people aware that we're here talking about COVID. We're not going to let it go away because we want to be your connection to keep you informed about what's happening in our community. I want to say thank you to Groundwater Solutions, groundwater-solutions.org, groundwater-solutions.org, 704-596-0505, 704-596-0505. I also ask that you please share, make people aware that Atrium Health has also shown confidence and let them know that Tanya is here working as a COVID vaccine ambassador, sharing this information to get out to our community. And lastly, if you have any suggestions or any topic that you would like for us to cover, my email, rivenstanya@gmail.com, rivenstanya@gmail.com. So we're headed towards the big holiday. 4th of July countdown is on. You probably got some big plans for the weekend. And what I've been noticing as I've been out and about in the community is a lot of people are not wearing their masks, but more people gradually are starting to put them back on. And I find myself, I said last week, I'm kind of convicted sometimes when I'm out and I see people with their mask on. I kind of just slide mine out of my bag and put on as well, especially if I hear some coughing or sneezing going on. And I must share the story real quick. I was at a department store. I'm not going to say the name. And the lady, she was really sick and she was over there coughing and sneezing. And I had walked over with another salesperson and she said, "Hey, you're not well." She goes, "No, I'm sick." She goes, "Well, you need to go home." She goes, "I'm the only one here." Think about how many people that struggle because they need to work and they're really sick. And we're in this kind of season right now. It seems like it's been around for quite some time. My heart just went out to her because she was obviously sick. But what the sales rep said, which she didn't have to tell me twice, we got to leave from over here. And that's what we did. We got up and moved. I was like, oh, that can wait because I'm not trying to pick up any kind of illness or anything that's in the air. And it was very clear that she was suffering from something. And I would venture to say it may have been COVID. And I told her, I said, ask her if she gotten tested or even suggest that she goes to get tested. Even if people may be offended, you got to speak up, folks, because our numbers, I saw a figure earlier where the numbers are continuing to increase. I think the CDC, the Center for Disease Control and Prevention, says up about 35%. And it's on an uptick, which we cannot ignore that. But I got a great conversation for you today. I'm looking forward to this conversation as well. I've got my father-in-law in town, and we have some interesting conversations. And I share with you the lady who had lost her husband. She's still getting it together. She's coming. She promised me this week. She still wasn't quite ready. I said, that's okay. And so I found someone to step in. Of course, coming up later on, Dr. Tricia Black, always with us. And she's got interesting information to share as well. But I want to bring on with me right now because he always has plenty to talk about. And we have great conversations always as well. And I'm talking about none other than my father-in-law, Mr. Ali Rasheed. First of all, good morning and thank you for joining us.
Good morning, Tanya. How are you?
I'm doing absolutely fantastic. And you know, we have conversations about COVID and I respect especially the wisdom and all that you share on this. But let's start by just introducing you to our viewers and letting them know you all are visiting here from Cape Verde. So when I say that, and I'm probably even pronouncing it incorrectly, kind of show people or articulate to them where you're located.
We're located about 350 miles due west of Senegal in West Africa, and it's an archipelago in the middle of the Atlantic.
Well, of course, right now you're here visiting, and we're grateful to have you here as visitors. But let's talk about the impact of COVID in Cape Verde. How impactful was it, or what was it like for you all? You know, we know here in the U.S. we've lost so many lives. Who would ever even thought that we would hit that number? And I'd just like to know what was it like for Cape Verdeans?
Well, in Cape Verde, I'm on the island of San Vicente. There's about 11 islands San Vicente is the seventh most populated island, with a population of somewhere around 85,000. So
Okay.
it's not a very large island. And the people there are very gregarious. I mean, they're always getting together, the families together, weekends, friends, they're partying, they're barbecuing, eating fish. And so when COVID hit, Cape Verde tried to follow all of the rules and regulations for that the Europeans, because it's a Portuguese was a Portuguese colony.
Mhm.
So these people hang out on the beach. They hang out together, and when they forbid people to go on the beach, it was a problem. And
So
so
they didn't take to it very well, huh?
no, they didn't take to it very well, but it was enforced, and they closed down the restaurants, they closed down the bars, nightclubs. You couldn't go in. One person at the time in a grocery store
Oh,
if you
wow.
had your mask on. And so, in our case, a lot of people could not afford to buy a mask, even though it may sound crazy. So the government would provide some masking. Now, what we had, it was about, I think, on my island, as far as I know, somewhere around maybe 100 to 200 people were had it, but they were not hospitalized. It was just that they tested positive for it. I think for me, what was interesting and really quite funny was that the people were really, really afraid. I mean, people said they thought everybody's going to die if you get it. So they were walking around with their mask on, and nobody on the street but them, riding their bike with the mask, in their cars. I'm going by themselves. I'm going like, well, maybe there's something to this. So I did
Let me ask you, when you say that, as you understand it,
Mhm.
were there many deaths, on your island as a result?
No, no. We had I don't know of maybe two or three deaths that I know of. I know one person who had a very bad case of it, and
Mhm.
it lasted for about 3 months. And after that, he had, I guess, what they call long, what do you call it?
Well, that long-term exposure, and so then a lot of people have a lot of after effects. We've had several guests on who have been on and they've had different problems, whether it was with their lungs or whether, I've got people that say they're challenged with brain fog, a
Yeah.
lot of different things that are happening because of the whole lack of oxygen that was denied as a result of the disease.
Well, let me tell you something. I was one of those people who refused to be vaccinated.
Okay.
I don't believe in them. I mean, I never get the flu vaccination. I don't
Okay.
think I've ever had the flu. If I did, maybe 50 years ago.
Okay.
So I know I do admire people who decide that they want to have a vaccination. Everybody should have that choice. I just choose not to be vaccinated, and fortunately for me and my wife, we did not get COVID while we were in the Cape Verde Islands.
Well, let's
Uh,
talk about over and one of the things that you talked about just now is maybe why would you think that the numbers were so low over there? Let's touch on that.
okay.
Besides the population, when you look at percentage or put it in perspective, why do you think?
Okay. Well, the majority of the population in Cape Verde now is under 25. Very young population. That's one thing. The other thing I think is they're always in the sun. The temperature average is probably about 85 degrees, sunshine, and people are always out walking, exercising. And they don't, for the most part, they don't eat very much because they can't afford to eat very much.
Okay.
But I think that's a big part of it is that they're outside, their diet, and I think it's just that they have a very pleasant outlook on life, very warm and outgoing people. I think that has something to do with it.
So when you take that in perspective, you've touched on diet, active, and also out in the sun. By
Mhm.
comparison to the US,
Oh,
clearly there would be a difference.
clearly there's a difference, and I really believe that part of the problem in the U.S. and in European countries in general, I'm pretty sure in my mind, and I think scientists have proven this, It has to do with the people's diet, lack of exercise, being sedentary, eating a whole lots of sugar. Uh, I was looking at one thing. It was talking about in the 1800s where the average amount of sugar was something like maybe a couple of teaspoons, and
Ooh,
now I mean you can get 16 teaspoons in one soda.
yeah.
So I think that's a big problem, the major problem, and I think also that when they look at the people who actually died or had the biggest problem, these were people who had the autoimmune diseases, diabetes, heart disease, and all of that kind of stuff, or grossly overweight. I think that if the American people would change their diet, start eating more vegetables, more fruits, eating less sweets for sure, and that's going to be a problem because it's an addiction, and that addiction is greater than addiction to cocaine. It's hard to break.
I'm right here. You're looking at the poster child, so there no argument there. But you just hit some really powerful notes, which is what we've been talking about as well all along. Again, we talk about real talk and real resources. Is the whole healthy, our diets, the healthy lifestyle that
Yeah,
we are lacking in our community, and there are a lot of efforts now being made to address that. And that's one of the things that COVID did. It just ripped off the whole bandage on all that's happening in our community. Not that we're the only ones that suffer, but if you recall, initially, we really did get hammered with a lot of deaths in our community. And
we
so
did.
we have been dealing with that. But now you're an elder and you've been traveling. You've already said you didn't get the vaccine. How has that been like for you? Are you not concerned because you've been traveling out of the country? You're in the U.S. now.
Yeah.
What are your thoughts? Or please share this with others.
Well, I don't have any fear of it because, to me, COVID is real. I mean, it's real. And for some people, it really, really hits them hard.
Hmm.
And I know there's been a lot of deaths. So, I mean, I'm not one of those guys that say, well, I ain't getting the vaccine. It ain't real. I'm not crazy. You know what I mean?
Okay.
So, but I think, for me, as I travel, the one thing that I found that, and oh, by the way, oh, I got
Uh-huh.
COVID. My wife and I, we were
Okay.
traveling. When we come to the United States, we got COVID.
Oh,
Yeah, we got it. And so, but it was extremely mild. And so now I think I'm in a position now to where I've got immunity.
okay.
And so I'm fortunate. I'm fortunate. I think the
Well,
biggest problem I had from traveling is on the airlines, the airplanes. I did not understand why they force everybody to get the shot, show it
mhm.
before you get on the plane so you don't got no COVID. Then you got to wear a mask all the time. And inside the airplane, the air is circulated every few seconds. So if there's anything in the air, it's gone. So I didn't understand that, why they were requiring that.
Well, we'll have some experts to speak on that, but I have my take on the air that circulates on the
Okay.
airplanes as well. If you talk to some of the flight attendants, they might tell you something a little bit different from time to time. And you probably know you've got a
Yeah,
daughter that's a flight
that's right.
attendant. And so it doesn't hurt to take those precautions.
Yeah.
Mr. Ali Rasheed, as we wrap things up, is there anything else that you would like to share?
Well, yes, I would say this. If you are concerned, really concerned, really frightened about this, I would advise you, if you would, to get scientific information. A lot of it's coming out now that they didn't have when they first came out,
Mhm.
and put this thing in perspective. Protect yourself. If you want to wear a mask, wear a mask. If you're going to be around a bunch of people that you don't know, you should be wearing a mask. I
Mhm.
do put my mask on when I'm around people, but I don't wear it in my car. I don't wear it when I'm walking.
Yeah. Well, I
Oh,
appreciate that. But
let me just,
let me
I
say,
just want to say
some
one
people might
thing.
forget to take their mask off when they're driving. I know
No, no,
I
they
do
didn't
that too.
forget. They were serious. Can you riding a bike with the mask on? So anyway, I would like to say this though to your audience that
Yes.
I really, really admire you and what you do.
Oh, come on,
You
your family.
you do great work in the community, and not just 2 or 3 years like people. You've been doing this for a long, long time, and I
Oh.
know you're making a great sacrifice to do this, and I really applaud you for it. Not just because you're my favorite daughter-in-law, but because you do some great work.
Well, thank
Continue.
you. You
Keep
got me
on.
blushing. All right.
Okay?
Thank you so much. This is now you can understand why he's my father in love, Mr. Ali Rashid. Thank you again for taking the time to share and to join us on this broadcast.
And thank you for having me.
Absolutely. You see, I really appreciate him and that wisdom that he's just shared, not because of me, obviously. I try to say over and over and over, it's all about the community. We do it for the glory of God and just to kind of educate us. And when we started this program, it was all because, you know, I wasn't hearing our stories. People they weren't speaking to us. It was all mainstream. And there's also always a different angle, always another approach that we need to hear about, need to be made aware of, like having him on speaking from a perspective from Cape Verde. So as we continue, if you notice the last couple of weeks, Dr. Black has had to join me, and we've had to record this segment so that we made sure that we got her on the air, but also just for the fact that she always brings some really good insight. So as we continue with this broadcast, here is Dr. Black as she also continues to share. So we had a great conversation, as you heard, with Mr. Ali Rasheed, and sharing his experiences, his thoughts, that is, and his wisdom, which is most appreciative, as we bring people on to share real life stories, real people, real talk, real resources, and a conversation about how it's been impacting his life. We've all been impacted in one form or another, but we certainly all can learn from one another as well. That's what I'm so grateful for, because these little nuggets help us to understand the times that we're dealing with and how can we improve and how we maneuver this thing, not just life, but this pandemic that continues to have an impact. Now, I can't have this conversation alone. Every Tuesday, I have to bring on a very trusted resource, none other than Dr. Tricia Davis Black of Groundwater Solutions. Thank you so much, as always, for making the time, because I know you're busy as well, a lot going on, but always making the time to join us. One of our sponsors, groundwater-solutions.org, 704-596-0505. So first of all, good morning and thank you for joining us.
Good morning, and thank you for having me. It's always a pleasure to be here.
Well, Dr. Black, I appreciate you always weighing in on our conversations and the guests that we have. So you heard Mr. Rasheed talking about what he has been experiencing, and he shared something really interesting. He talked about the impact of COVID in Cape Verde, but he also said he thought that some of the health problems, namely diabetes, really helps contribute to how it impacts our lives when people get COVID. How would you weigh in on that?
First of all, I'd like to say, I think Mr. Rasheed is a perfect example of what it looks like when you live in a way that promotes health. For him to be in his senior years and have survived COVID-19 at a time when it was significantly severe, shows that he's done some things right in his life. I think when we look at the continent of Africa compared to a place like the nation of the United States, where we are industrialized, life, we believe it's better. We have amenities at our fingertips. It has created many things about our lifestyles that just isn't going to promote long-term health. When we're in our 80s, we may not be in such a good place as Mr. Rasheed. Folks in Africa are more mobile. They are out in the sun. They are walking more, using transportation vehicles less than we do here in the United States. And when you live a lifestyle like that, the end result is better health. So I think that he's right on point with that, Tanya.
Well, and you know what's so interesting is that you picked right up on that. And a lot of people probably never even thought, never crossed their mind, because what we think of as living in the United States is that, this is really the good life. And I'm not knocking that and probably casting a doubt on, say, these African countries because of the resources, the lack of resources. And what I'm hearing from you is sometimes the lack of some of these resources actually would benefit us.
Exactly. Their diets are more plant-based than ours are. Their portion sizes are more moderate, where, everything here is excessive. It's bigger. It's more fat and more what we believe sustenance. And that doesn't always mean better. More does not always mean better. And we've got to learn that. I think about history and how, times across, especially European nations, that we thought wealth meant eating more in a gluttonous kind of way. And it just doesn't.
Well, I really appreciate you pulling that nugget out because again, it never even occurred to me. And so they're doing some things right. Not that I don't realize the value of so many things from our ancestors and what
Mhm.
has been passed along during the years over in Mother Africa. But
Okay.
certainly just to uplift that when we're dealing with COVID, because, a lot of the conversation was around when it started impacting some of the poorer countries and how they didn't have access to the vaccines and,
Mhm.
how it was going through.
Mhm.
Clearly they've been able to manage as well.
They've been able to manage. They turn to natural resources, things that God created for us to be able to stay healthy and well. And they've done a good job of that. I think the challenge is for us here in the beautiful and land of the free America, that what can we take away from them that we need to incorporate here? I mean, how often, when you go to the grocery store, when you park your car, do you want that closest parking space?
Yeah.
When one, can we walk to the store? I have a store, a food line that is literally in walking distance to my house, and I've never walked there. But I do see people walking with their groceries up and down
Mm.
the street. And you know what I think? Oh, they
But,
must not have a car.
uh, well,
And
I gotta tell you, I get my walk in every morning, so I am working on that, and we're gonna have to work on you. If you're
okay,
close enough to walk, Dr. Black, you're gonna have to get
that
out.
that is going to be a
Yeah,
challenge. That
that's
if
right.
during the
Just
month of July, I'm going to
yes.
walk to the store.
Right, one foot in front of the other. That's all
Mhm.
you have to do. Hey,
Mhm.
let's talk a little bit about, and thank you for that input as well. But let's talk about the latest, which is on today. The FDA, Food and Drug Administration, they're supposed to kind of weigh in on an updated COVID booster shot that's supposed to be provided for the fall. It's the next round of COVID booster shots, and what is it going to look like? And there's an advisory committee working today. They're going to review the vote on potential changes to the vaccine for this fall. And so let's talk about boosters. More boosters in our history, or yeah, in our future rather. We've had them
Mhm.
already in the history, but
Mhm.
more boosters to come.
Yeah, I think the folks who are in healthcare who have been administering the COVID vaccine,
Mhm.
we understood the guidance from the very beginning that boosters would be needed, and
Okay.
not just one booster, that there would be continuous boosters needed for however long, we don't know. And as long as COVID is here, if you have selected the vaccine is your way of ensuring your health and safety, then be prepared to continue to receive boosters indefinitely. So, and as a provider and other providers around the country, we are continuously administering boosters. Whether it's you're in that slot where you need a booster at 6 months or 12 months.
Mhm.
We are giving boosters for folks who got the first vaccine 6 months ago. So we are fully prepared and expecting to stay on this road.
So I'm trying to understand too as I'm looking at the notes because apparently, if you haven't been boosted before, this is kind of like a backup. It doesn't matter if you haven't had the first or second one. I think what they're trying to do is give you one that would still have the would be, I guess, the potency or
Mhm,
potency to
mhm.
still sustain against the variants, not just from the past, but as you move forward. Is that correct?
That is correct.
Okay.
So everyone who has received the vaccine needs a booster. So I believe that this is a way to kind of bring the attention back to the forefront in the country, since COVID has taken a back seat and people are of the impression that it's of no regard right now and we don't have to be concerned. It's a way for us in the United States to say, hey, boosters for the fall.
Mhm.
There'll be just like flu vaccines, and as
Right.
the winter months start to approach and they say it's time for your flu vaccine, I believe that's probably what the impression or the media is going to put out, or leadership in healthcare is going to put out, that the fall is the time to get your COVID booster.
So this is just going to be ongoing, folks. We just have
Mhm,
to realize that. And the Center for Disease Control and Prevention, they're saying the two subvariants that we've dealt with in the past, they have started to gain ground in the U.S., making up
mhm,
about 35% of all new COVID cases. So clearly, the conversation around the FDA and the two drug companies is how important or impactful will this booster shot be when it comes to dealing? What impact is it going to have on
Mhm.
these variants? I think that we're still fairly okay as far as numbers here in
Mhm.
Mecklenburg County, still in a moderate position.
Mhm.
So we haven't moved beyond that point. And I just verified that on the Mecklenburg County Health Department website. But should we be concerned about the financing? Who's paying for all this stuff? I guess.
Exactly. That's the question from a healthcare perspective. The providers who are remaining out there in the community, still providing the vaccine, still providing COVID tests, because again, COVID is still out there. Me headline alert for those who are listening, it's still out there. Folks are still coming up positive. We had an outbreak within our organization last week. We had to, and we follow COVID safety protocols. We shut the office down. We
Mm,
had a sanitation company come in and clean and do the fog to make sure that we have eliminated the virus from our building. And then we reopened the next day.
wow.
Companies are not necessarily taking the precautions that need to be taken to protect the folks who are in our environment. So I think we still, first of all, need to keep doing what we've been doing. And secondly, we need to make testing and vaccination available. But if you remember, February of this year, there are HRSA funds that the
Yeah.
federal government put aside for testing and vaccination is no longer available for
Mhm.
providers. And this particularly affects those who are uninsured. How do we pay for it? We want to make it available. We obviously are seeing that in the fall, boosters are recommended, but there is no funding for that.
Mm.
Yeah. So I don't have that answer, Tanya. I don't know. As providers, we've continued to do that, but I've
Mhm.
had discussions with my finance and leadership team to say, how long are we going to keep doing it? Do we have the infrastructure and resources to continue to provide what this community needs? So that's the conversation we're having internally, and conversations that we are pushing at the state and federal level.
It just seems like there's always all of these moving pieces, and we cannot just get our arms around it and bring it all together. That's just, and I know not to take away from anyone's efforts and their work and how we're navigating
Mhm.
just everything that's been thrown at us over the last 2 years. But it seems like, the people like to compare it to playing chess. I just want to bring everything together, how we can put this all on just a simple little puzzle, although it's not simple,
Exactly.
and fill in this blocks, if you're talking about booster shots and the underserved and the
Mhm,
challenged community is always seems like at the bottom of the realm, and then you talk about how do you change that. Well,
mhm,
it seems fairly simple, but here we go again. If there's no funding there, and these are a lot of our essential workers, I
mhm.
think let's not walk back into the same thing this fall.
Exactly, exactly. And the questions that's been asked by providers is the community willing to pay for it? If
Hmm.
you had to pay out of pocket to receive this vaccine or a test, will you do it?
Oh,
And
wait a minute. Everyone got all this funding though, these COVID relief funds. What about that money? I mean,
yeah,
I'm talking millions. People are trying to figure out how to spend it.
billions have gone
Yeah,
out.
so what about that funding?
That is a good question. I was speaking with a colleague yesterday,
Mhm.
and she said, well, that there's money sitting there at
Yeah.
the state level. Um, and I said, well, I sit in the meetings and they say that the money is gone. And they said, no way is all of the money that's come into North Carolina gone.
Mm.
But who holds the purse strings?
Right,
I,
right.
I would say to the public and the audience who's listening is start asking those questions. It's
Yeah.
where is that funding and what's going to be available? We can talk nationwide, but let's talk here at home. What's going to be available here in North Carolina to support the needs around COVID-19 that still exist? If we're saying that this pandemic is still going on, they haven't yet. We know that it's becoming endemic,
Mhm.
that there will one day we will call it an endemic. But what is going to happen with the funds that we know have come in? Have they been used? If they've been used, let's see a breakdown of where they've gone. But if it's
Absolutely.
some still sitting there, then why are we holding it in this pot somewhere when it's needed out here on the streets where people live?
Absolutely. So let's check in on Groundwater Solutions and get an update. How are things going? Where are you all at with everything? I know there's a lot happening.
There is a lot happening. We are working again. I think I've told you all about the medical practice in
Uh-huh.
Gastonia that we've launched. We are working to really integrate healthcare.
Okay.
Tanya, again, my background is behavioral health, and we have operated in these silos, like your mental health issues and
Mhm.
addictions and things like that are over in this pile, and your medical care is over here. But we're really working and want to develop a model for integrated health, whole person health that really transforms this community. That is our goal. And
Okay.
in addition, we are planning to offer some natural and holistic alternative strategies for health that may not include medication. You know,
Mm.
there are some natural herbs and supplements, much like what is used by Mr. Rasheed
Mhm.
in Africa, that we will bring those things here to the United States, not only make them available, but make them available for those on the lower socioeconomic spectrum who cannot afford to pay, $100, $200 for
Mhm.
those treatments.
Great, great. Always doing great things in the community. And that's why we appreciate you so much. Again, groundwater-solutions.org, 704-596-0505. Dr. Tracia Black. We always appreciate you taking the time
Thank
to
you.
join us. You enjoy the rest of your day.
Thank you. You too.
All right. And guys, again, a great conversation as always. We are committed to being here with you each and every week, bringing you the best information that we can pass along to you as far as what's happening with COVID. Of course, an ongoing conversation, real talk, real resources, real people. That's what we do. Hey, if you know anyone that's looking for, I'm sure I can't get the flyer up for you, but food outreach happening in Cornelius. I've got to make sure people are aware. July 8th, it starts at 10 a.m. Smithville Park, exit 28. Please pass along the word. We're providing food boxes courtesy of my nonprofit 501c3, the Ossie and Martin Ryden Scholarship Foundation. Again, that's coming up on July 8th. So I know you're getting prepared for the big holiday weekend. We've got the 4th of July celebration on this Monday, but don't forget to tune in to me on Saturday. Sounds of Inspiration kicking off at 6 a.m. It's 10 a.m. It's off at 10 a.m. from 10 until 2 on Praise 100.9, bringing you inspiration and information and also my gospel entertainment segment. It's called Tea Time. As always, life's challenges make you better, not bitter. I'm Tanya Rivens. I thank you so much for tuning in. Thank you for your support as we continue to work together. You know how it goes, and you know exactly how I feel. We're going to keep working at this thing because together we plan to cancel COVID. Thanks for tuning in, everyone. Enjoy your day. Enjoy the weather. Be safe, be alert, be well, and check on your neighbor. And as always, thanks for joining us. Have a great day.